Hi, my name is Renee Heffron. I'm a professor of medicine at the University of Alabama at Birmingham. And at my university, I also have a role as the director for the Center for AIDS Research and a new role, which is the Senior Associate Director for Research in the Division of Infectious Diseases. I'm going to talk today about my leadership project and also some reflections on this leadership journey. My leadership project was called a Toolkit to operationalize global health research using systems that facilitate equitable team building and shared power. So I've been doing HIV prevention research for nearly 2 decades now and have developed close collaborations with a number of colleagues in Kenya and Uganda. In academic research, we often forge partnerships with collaborators who are located in lesser resource settings and with fewer opportunities for funding the research. And together we do really meaningful work. But over the time, I think in conversations with my collaborators, we've come to realize that we can be intentional about how we set up teams and systems if we envision sharing power and facilitating capacity strengthening among all team members. This thinking and implementation is certainly not limited to academic research, but likely can be applied to many contexts. And you'll see one of my longest collaborators, Dr. Nellie Mugo from Kenya in the picture on the right. So as part of my leadership project, I wanted to dive into this idea a lot more about how to be intentional about setting up sharing power and facilitating capacity strengthening among all team members. And in 2021, there was a master's student at the University of Washington named Dr. Felix Mogaka. And in his thesis, he worked with a colleague of mine named Janelle Stewart. And they elicited thoughts and experiences from a number of global health research partners. And Dr. Mogaka's work was on the topic of decolonizing global health, and he used it to draft a toolkit to examine power structures among research teams and collaborators, and then actions to yield more equitable power structures. So I contacted Dr. Stewart and Dr. Mogaka, and for my leadership project, I started working with them to refresh their learnings from 2021 and work towards a publishable manuscript and a user-friendly tool that can be shared widely, really to move Felix's work, really to move Dr. Mogaka's work to the next level and make it more widely available. So out of the thesis came a number of recommendations, and these are 5 of them. They relate to equitable budgeting and figuring out how to do that, including having transparency in the budget ceilings of research grants, carving out formal training opportunities within collaborations, identifying strategies that facilitate team members who don't always have advanced training to work with data and actually lead secondary analyses. To think about mentorship across non-clinical research cadres, things like the data analysts, the counseling staff, and others at the trial sites. And then to support community engagement as independent co-creators of the research. So these were their recommendations. And we decided to try LinkedIn as a means to refresh the conversation and collect ideas about how to grow the toolkit. So we've been working on this recently and we'll continue working on it. We've had 3 posts to date. With the posts, many of them were liked. There were many likes. There were not many comments though. And there were 2 direct messages though that led to deeper conversations between Dr. Mogaka and some of his colleagues. On the left, I'm showing you just a picture of one of our posts. We thought really hard about what does it mean to post something on LinkedIn and then to collect people's reactions and people's comments about it. And so we wanted to make sure to tell people how we were going to use their comments and that if they didn't want to put something in the public space, they could send us a direct message instead. So our plan is to continue doing this and leverage not only the actual comments from the post, but the people who are liking our posts as potential people to have more direct conversations with. And eventual outputs from this may include a published manuscript with easy to visualize checklists and talks that we would be able to give to prompt more engagement and discussion on this issue. As I reflected on this journey over the last year with the WomenLift Health program, there's a number of things that I'm really grateful for and that I've learned. The first is that being my authentic self really feels good to me. And it's easier to be that way than to be something else. I've also come to recognize that my leadership style is different than many around me, and speaking specifically about a school of medicine, which is a new experience for me and not a place that I trained. And it's different because I've had different experiences that led me to this point. Also, this is something that I now embrace and now see as a strength. I'm really grateful for the time to consider my life strategy and to keep it in focus as I take on and consider new roles and how to do my work. And finally, I'm certainly grateful for the peers that I've met, whose experiences and leadership style will continue to influence mine and lift me up. In the center is a picture of me with one of the research teams that I work with in Uganda, from celebrating the completion of data collection and high quality results. The celebration happened in November of 2024. And it's just one thing to show you and tell you about how, when I'm my authentic self and can come and celebrate with teams and do that good work, it's really something that I love to do, and that's very meaningful. So thank you for your time today, and I'll be happy to answer any questions.